Within the eating disorder community, there's definitely a lot of weight stigma.
My experience in the medical field when I was trying to seek help was not really positive because I don't think they took me seriously. I mean, they took my potential obesity when I was younger much more seriously than they took my life-threatening eating disorder, um, and I think that's where it really is harmful.
So, being in a higher body size in treatment in the eating disorder community and all sorts of different things, it would be you must be doing so well now because you're not emaciated.
Whenever I see a new provider or go somewhere and they, kind of ask for like a list of diagnoses or something like that, and use, like I say, I have an eating disorder because of my weight, they look at my weight and they say, okay, yeah, you struggle with binge eating, regardless of the fact that there's other things I struggle with, but they kind of choose to overlook those things. And then the other thing I would say is that I was at a hospital, and I was very deep in my eating disorder, and there was an eating disorder unit I could have gone to, but there was a weight criteria in order to be on that unit, which for me I thought was really ridiculous, which just added more stigma to that illness in general.
Hi, I'm Blythe, and I'm the author of When the Fat Girl Gets Skinny, the viral spoken word poem and short film. I wrote that poem because I wanted to talk about how our culture reacts to eating disorders and how people's well-intentioned comments of encouragement actually translate to getting someone to continue and maintain their eating disorder. For me, growing up as an overweight child, I was taught that my body was an issue that needed to be fixed. I was taken by my parents to Shape Down, which was a Weight Watchers program for children, and everybody had a problem with my body, and I didn't learn to be ashamed of it until I realized that I was supposed to be. But it made me realize after I developed an eating disorder and I received positive reinforcement from every aspect in my life. At school, I would walk down the hallways and girls would say, "You look so good. How did you do it? What is your secret?" And at home, my parents would carry around my before and after photo. They were so proud of me for my weight loss. And so when you're trying to recover, but dealing with the fact that people are so happy for you for being thin now and they don't even think about the fact that you starved yourself to get that, that's really harmful.
When I went into treatment for an eating disorder, I was struggling with restricting and purging and entered a day treatment program. After about a week, I had a family therapy session set up with a family therapist who I had never really gotten to know before. She didn't really read my chart before meeting with me, and her first question was, "How much do you binge?" I told her that I don't binge. That's not what my eating disorder involves. And she said, "Well, I'm confused because if you don't binge, why are you not underweight?"
I had an eating disorder for 15 years, from the time that I was 12 until I was 27. Throughout this entire process, and even in telling people outside of the field, constantly invalidated and said, because of your size, you can't possibly have an eating disorder. You couldn't possibly have had a restrictive eating disorder. I also had a dietitian tell me, don't worry, you'll lose this weight again. Where if they had even just looked at the medical records from the previous time that I was there, they would see all of the notes of concern. They would see that I had to eat in a different room because I would only restrict and trigger the other patients. And so my size always dictated the way that I was treated. And so as a result, it completely invalidated all of the work that I had done. When I was in outpatient treatment, anytime I would see a new psychiatrist, for the most part, they would ask me my lowest weight, and almost every single one would say, "Oh, that's not that low. That's not that bad." And even when I would say it was bad for me, it was at a point where I was barely eating anything, where my therapist had said that if I did not change my behaviors, that she would no longer see me and I would need to go into treatment. And so in all of that time, I wanted to be able to prove that I in fact had the eating disorder that I said I had. So my body size is never an accurate indicator of how I'm actually doing. It doesn't tell you what I'm doing in terms of my food. It doesn't tell you what I'm doing emotionally. All it tells you is that this is the body that I was genetically predisposed to. And so I think the important thing to know is, first of all, if someone says this is what they're doing, if someone says these are their behaviors, believe them. They know more about their body and they know more about things than you do. And their size is not going to tell you how they feel. Their size is not going to tell you anything, really. It's not a relevant indicator. And so because of that, patients in higher body sizes are constantly being told that they don't have an eating disorder. And so will continue to do things that are incredibly harmful for them.
The weight stigma in the eating disorder community is high, and it's definitely something that needs to be changed and addressed